Babe, I think there's something wrong with my boob.
What?
I feel a lump in my boob. I think I might have breast cancer.
I'm sure not. I'm sure you just got bit by something. You know you were out in the yard yesterday, so maybe you got bit by a spider or something. The mosquitoes are pretty bad right now. Maybe you just had a reaction to the mosquitoes. I'm sure you're fine. I'm going to bed.
That could be true. Good night. I still feel something there. Let me go visit my friends. Hey man, how you been?
I've been good. Nice to see you. It's been a minute. Wife been locking you up in the house, huh?
Yeah, something like that.
So, what's been going on with you?
I don't know, man. I feel like there's something in my breast, my boob. I feel like I might have breast cancer.
Man, are you cross-dressing or something? What do you mean your boobs? What? I don't understand.
No, I really think there's something wrong.
You said breast cancer, like what women get? Are you sure? I mean, I don't think I know of some of my wife's friends that have had it, but I've never heard of a man getting it.
I looked it up. I think man can't get it. Or my wife said it might be a bite. Who knows?
I agree with her. You know women are always right. But who am I? I'm not qualified. Maybe you should just keep an eye on it or so.
Yeah, I think I will.
All right, man. Well, let's throw a few back and maybe that lump will be gone after that.
All right.
Hello, Mr. Finnegan.
Hey.
I'm Dr. Nancy. Can you tell me what's going on with you today?
I just recently felt a lump in my boob, and I want to get it checked out.
So what do you mean by a lump? Is it a bite or can you explain a little bit further? How long have you had it?
It's in the inside. It's been going on a couple of days now. I think it might be breast cancer.
Okay, let me come take a look for you.
Uh-oh. Your hands are cold.
I'm sorry, I usually warn the little kids about that, but I do apologize. All right, so I've checked you out. I don't think there's any cause for concern. I would say go ahead and put a little bit of Neosporin on it. If it aches a little bit, maybe a little ice pack, and I'm sure the swelling will go down. I think it's just a bite, nothing poisonous. It's pretty common. I've seen this before. Were you out doing any yard work?
Yeah, I mean, the other day or so I was.
Well, that explains it. All right, we'll go home and get some rest. Anything else that I can help you with today?
No, I think that's it.
All right, see you soon.
I still feel like something's wrong, but guess I'm gonna just go to sleep.
Honey, is that you? Are you okay?
Yeah, it's me. I'm fine.
All right. How are you?
I'm good. It just hurts a little.
What's going on? What's hurting you?
My chest. I think I might have breast cancer or something.
Okay, let me take a look at you, okay? My hands will be just a little cold, so bear with me, okay? I'm gonna lift up your shirt and just take a look at that lump. Left side or right side?
The right side.
Okay. Okay, upon your exam, it does look like you have a lump. You said it's been there for a few days, right?
Yes, it has.
Okay, well, we're going to take a biopsy. So a biopsy is just taking a sample of that area, and we're going to send it down and culture it and get some labs and kind of see what's going on with that area. I know that you mentioned in your paperwork that you treated it with Neosporin and some cold compress. Did that help at all?
Nah, it seems like it's just getting worse.
Okay, not a problem. So we're going to send those labs off so we can kind of get to the bottom of this. Now, I know you've probably heard breast cancer and it's been really prominent in women, but it is possible for men to get breast cancer as well. So I don't want you to be embarrassed, but like I said, we'll send those labs off and I will give you a call when I find out the results of those labs, okay?
I told my wife, but thank you.
All right, sir. Have a good one.
Bye-bye.
To narrate this story, my goal audience was healthcare providers, specifically primary care physicians who see and diagnose patients because they see them often and build rapport. They are easily able to influence the patient and let them know what's going on since they followed them throughout their whole life. I just want to emphasize that healthcare providers should properly incorporate sex and gender in healthcare. Sex differences are based on biological factors, including reproductive function, hormones, and expression of genes. Gender is associated with behavior, lifestyle, and life experience. It can determine use of healthcare systems and behavior and attitudes towards medical personnel. Typical gender differences in healthcare include differences in preventative measures, prescriptions, health insurance, reimbursements, and referrals for surgeries and/or therapies. In this scenario, women are more prominent in breast cancer cases, but it can occur in men as well. Screening for men is less common and may be declined by men. There are cardiac, pulmonary, immunology, neurology, oncology, and many other clinical divisions that have sex and gender differences in things like the onset of symptoms and reaction to treatment. Healthcare providers can run into issues when needing to treat the biological sex of a patient, but the patient identifies with the opposite gender. For example, in a situation of this scenario, a woman may identify as a male and may take testosterone. Overall appearance could make her seem like a male, but it is necessary for her to do checkups with things like breast exams and pap smears. The patient may feel as if you are trying to revert her back to being a female, but you must be sensitive when addressing this matter and let that patient know that their biological makeup puts them at risk for diseases prevalent in women. If the patient is non-compliant, then screening and prevention can occur, which may lead to problems down the line. Training medical professionals and having protocols can ultimately help with gender disparities. The way that drugs are absorbed in men versus women can be a big difference. This will help give more efficient dosing. Knowing symptoms of diseases in each gender, such as women presenting with heart failure with no warning signs of things like abnormal systolic function. On the other hand, the male patient will present with reduced ejection fraction before heart failure. Knowing signs like this can lead to faster diagnosis and treatment. This exact case is due to calcium signaling, nitric oxide synthesis, and other factors related to biological sex of the patient. Screening in diseases where something is more prevalent in women, like osteoporosis, make it easy. Maybe it should be standard for screening to be universal. Overall, men and women are different. Body surface area, kidney function, drug resorption, excretion, and metabolism play a role in body functions, and this needs to be integrated into care.